A very good day, Bintol. I'm Roisa binti Muhammad Nazir, the first speaker representing a group of 5, and I'll be introducing the side of the motion we stand for in great persistence, which is pharmacists should be allowed to prescribe medications by means of authority. Taking the affirmative ground for this motion, I'll be defining significant key points to the statement given. The term pharmacist in this context is referring to a healthcare professional who has been entitled to hold a Type A license by the relevant authority. The word prescribe, meanwhile, refers to the act of legally and legitimately ordering medications for patients. By the word medications, for an apple-to-apple argument, we define it as the drugs which can be offered to patients who seek primary care for ailments that can be identified and diagnosed without the need of complicated lab tests, like antihypertensive drugs, antibiotics, and insulin injection. Meaning to say, medications and psychotropic substances and those that require advanced clinical procedures are excluded from the context of medication in this argument. The last word to define is authority, and it correlates to the validity of a pharmacist's stamp to be eligible lawfully for the purpose of independent medication ordering, or known as prescription. It must be made clear that the certification of prescribing should be based on the pharmacist's demonstrated competence, and pharmacists must have access to the patient's medical records, and lifestyle modification remains as priority. The first bullet for our stand now is that by granting the pharmacist the appropriate authority in prescribing, patients can save the luxury of longer consultation periods. This is because, no different from most other professions, physicians are doomed to meet the KPI and the number of consultations completed per day, and unfortunately in government hospitals, the alarming average of 3 to 5 minutes per patient consultations is a must more than an option. The condition worsens when the physicians are further exhausted with the burden of having to see twice recommended numbers of patients, according to various news such as The Guardian. And the only way for doctors to make it through is of course by offering touch-and-go consultations, and this would reduce both efficiencies and the patient's satisfaction. In a more laid-back setting of a pharmacy, however, patients are able to deliver the complete story of their problems compared to doctors who are unleashed by time constraint and only ask what they want to know. With longer consultation times, pharmacists are able to provide better guidance for patients to discover more options which they would otherwise be deprived from during short doctor-patient consultations.
Next, pharmacists should be allowed to prescribe medication to improve access to medication to patients in areas with less healthcare facilities such as the countryside. Specialized training for pharmacists include residency programs which have been crucial to expanding the pharmacist's role. For example, community pharmacists are uniquely positioned to provide greater access to care for patients in the community by dispensing medication, providing education, and prescribing medication. When hospital is not available nearby, especially in the countryside, access to medication can be compromised due to lack of transportation option, extreme weather condition, or the patient being too sick to travel the long distance to the nearest hospital for consultation and prescription from the doctor. Rural population tends to be older and have more chronic health conditions than the urban population, which makes immediate access to medication important to the health of rural residents. For instance, the disease diabetes mellitus can be diagnosed on GP level as well as hypertension. If this illness is detected, then they can proceed with initial treatment. The pharmacist can prescribe the medication right away. This would greatly help the patient in the countryside. Given the frequency and intense follow-up required along with extensive education, pharmacy can play a critical role in the management of diabetes and other diseases.
Hi, I'm Aisha and I'll be the third speaker for this presentation. Next, I would like to add on that pharmacists has an established relationship of patient-centered communication compared to other healthcares, so this will build a stronger trust towards pharmacists compared to their healthcare practitioners. Hence, it will be a high benefit to the patient as well as the outcome of the disease if their pharmacists are able to prescribe authorized medications. Many of us have had experience going to the doctors. Thus, we've all experienced the feeling of nervousness trying to explain our sickness, especially when we have limited time with them, as was said by the first speaker. In fact, there's even a survey given out in 2010 about how the limited time with the doctors affect the patients. Most of them complain about not having enough time to talk about possible diseases with the doctors. In 2017, however, a new survey resurfaced where most patients do not complain about the time. Instead, there have been new complaints about how the medicine prescribed did not match the sickness that they have, probably because they weren't able to explain every single detail about their illness, and some of them even resort to lying to the doctor. Having a pharmacist giving out prescriptions gives the patients a higher chance to talk with them with no hesitation, as there's no time limit, and patients can slowly explain all the little details about their illness and all the symptoms that they are experiencing at the time. The patients may be nervous in the beginning, however, they are able to gradually warm up to a pharmacist as there's no time limit given to them and they can take their time to open up. This ensures the patient's satisfaction with the prescriptions given and can lessen the mistakes of having the wrong medicines prescribed by the doctors.
Assalamualaikum and hi, I'm Lufil and I will be the next speaker. So my point on why pharmacists should prescribe the medicine is because the pharmacist knows more about the medicine than the doctors. Since the pharmacist knows more about the medicine, they should be the one that prescribe the medicine. This is because pharmacist knows the content of the medicine in terms of how it was manufactured, the composition of the medicine, and most importantly, how it works. So from that, the pharmacist knows which medicine to use to treat the patient, thus giving a lot more option on which suit the patient better. And they will be more aware on the choices they made and know that every medicine has its side effect. For example, if the patient works as a truck driver, they need a medicine that does not cause drowsiness, so the pharmacist can give that option to the patient, as then they will know which medicine to give. So that's it for my point. Now I will pass to the next speaker. Thank you.
Hi, I'm Aliana, and I will be the last speaker from the government team. So, we strictly think that pharmacists should be allowed for prescription by the authorities, as this action will contribute in reducing the number of medication error and lessen the burden of the healthcare professionals. According to the National Coordinating Council for Medication Error and Prevention, they define medication error as any preventable event that may lead to inappropriate medication use or causing harm to the patient. Interestingly, it is a worldwide issue, and it is at number 5 main causes of mortality rate in the world. In Malaysia, the prevalence of medication error calculated in 2020 is about 30.5%. And based on this study, the most common type of medication error were wrong prescription, miscalculating of drug, that leads to wrong dose, timing error, and wrong route of administration. So why medication error occur? Well, it is a multi-factor cause, and the most common factors are heavy workload of the healthcare professional that actually cause tiredness among them, especially the doctors and nurses. This may lead to unaware of medication errors such as wrong prescription, and the most worrying is the prescription to the wrong patient. Secondly, overload of patient and understaff of the healthcare professional also contribute in medication error. This is because overload of patients, especially the critical one, may need extra care from the healthcare professional. This event and understaff may cause timing error, and possibilities of wrong route in administration of medication is very high. If this medication error occur, it may lead to huge impact on patient safety, and the risk of prolonged stay in hospital and even risk of death will be high. Based on the causes that I have mentioned, it gives a reason why pharmacists should actually be allowed to prescribe. This is because pharmacists is more particular in medication and has a lower risk in prescribing wrong dosage. When a pharmacist is able to help in prescription, the other healthcare professional able to be more focused on serious disease for a more beneficial outcome for the patient.
So in conclusion, we from the government team supports and firmly feel that the pharmacy should be allowed for prescription of medication in which the patient will benefit better in terms of longer consultation period, knowledgeable in drug in the pharmacist, stronger relationship with patient, improve access to medication in rural areas, as well as prevent medication error. Thank you.